Some kids that we treat are very, very young, 2 years old, less than 2 years old even, 1.5, that sometimes we have to do a lot of work on. And so we want to create that great experience for those kids. Sometimes the most appropriate treatment is conscious sedation, and sometimes it's general anesthesia. And we're able to help a parent figure out which of those options is the best for them. The conscious sedation is where we give a child a little bit of juice with some medication in it. That then soaks in for about 30 minutes or so. Then that kid tends to be a little bit more loopy, they're a little bit more tired. We use a little bit of nitrous oxide at that time as well, or laughing gas. About 90-95% of those kids are asleep throughout the whole procedure. Really helps out a lot. It's less expensive than general anesthesia, and it's a little less invasive as well. As it comes to general anesthesia, if that's the option that somebody chooses, that's where we have an anesthesiologist that comes into the office. They're able to help that child fall asleep. And then once they're asleep, we're able to take care of all that work. These options are great options for a young child who has a lot of work, or even an older child who might be apprehensive. As it comes to restraint for children, we do everything that we can to not restrain children. I wouldn't want that to happen to my child if we can avoid it. And so I wouldn't want that for somebody else's child as well. So that's where conscious sedation and general anesthesia are very beneficial.